Hello, my name is Nestor, and I reside in the DMV. I'm a minority, as you can see, from Latin descent. I got invited from my friend to go and actually hang out, and I was then told that I could have possibly been exposed to COVID-19. Because of that, I went to go get tested. Luckily, I received a negative result, so I was good to go. I went to the store and actually was pulled over for a broken taillight. The officer who pulled me over, I could tell, was racially discriminating me. He then asked me if he could look within the vehicle. He found marijuana, and therefore he proceeded to arrest me. After arresting me, I was held within a cell, and within the cell there was no social distancing happening. There was a lot of inmates, a lot of people there, and after that I began to feel really sick after being released and waiting for a hearing. I was feeling symptoms such as shortness of breath, muscle soreness. I had trouble smelling food and whatnot, and I was feeling very sick. I went to go get tested and actually received a positive COVID-19 result.
I work as a nurse in the state prison, and the prison is very overcrowded. Most of our IDPs, incarcerated or detained persons, are African American. In the United States, black adults are incarcerated 5 times more than whites. 1 of every 2 people incarcerated in state prisons has at least one chronic condition. In the early stages of the pandemic, inmates were given neither gloves or masks. Hand sanitizer was not available. Although this has improved, our supply situation is still not optimal. Staff members become infected too. We did not have adequate testing supplies for several months. We continue to not be able to test as frequently as we would like. Most people at this point are aware of higher incidence of COVID as regards the older population and those with chronic illnesses. However, most Americans are not aware of overall higher COVID incidence in the black population. When a more vulnerable black population due to comorbidities is confined to an overcrowded situation and there is not enough protective equipment or testing capability, the incidence of virus transmission will jump significantly, thus increasing incidence of illness and mortality. This is what happened. Many of the prisoners have to be transferred to our nearest hospital, which is overwhelmed. And while these patients are transferred out, other prisoners are being brought in. It is a never-ending cycle of virus transmission. These issues are gradually being addressed. Here on the forefront, I can't yet say if it's enough. Excuse me, I have some testing to do. Hey, don't waste the PPE. I work as a nurse.
Hello, my name is Julaya, and I'm a reporter, and I will be talking about the new outbreaks that have been happening throughout the United States and prisons facilities. So, there have been outbreaks of COVID-19 at Massachusetts' largest correctional facilities. The governor had to come up with a plan to commute the census of some of the highest risk vulnerable inmates. Also, I found during my research and a lot of investigation, I found that the spread of COVID-19 increased rapidly throughout Massachusetts. And not just Massachusetts, but Iowa and also Maryland. Additionally, the advocates demand to stop the spread in prison facilities. Data shown that approximately 172 inmates at Massachusetts Correctional Institution, Norfolk, more than 1 in 10 inmates at the medium security prison have been tested positive for COVID-19 in recent week, last week and this week. Also, I found that more cases are more likely to be increased throughout this week and during the winter season. It's going to be really, really hard for inmates to receive treatment due to a lack of hygiene, due to a lack of resources. Some resources really don't go out to African Americans and Latinos and other minorities. So therefore, they have to be released. And some are being denied eligibility to be released by the COVID-19. Also, I talked about earlier about Iowa. I found that the Iowa cases of COVID-19 in the prison system had rise daily. It's been really deadly. And it was hard for inmates to even find treatment or even to get treatment because it was too late. Some prisons in the United States are being denied eligibility to get released due to their time, due to how, the crimes that they committed. So this outbreak is really, really dangerous. Really, really dangerous. And I am a reporter again. My name is Julaya, and you all have a wonderful day. Bye.